Welcome to The Patient Physician, a space for doctors to explore their physical, mental, and financial wellness. Your peers and industry leaders will destigmatize institutional perceptions while redefining success, money, and personal care. Get ready to pull back the curtain because here, you are both patient and physician.
Welcome, everyone, to The Patient Physician. My name is Paul Smith, and I'm joined today by my co-host, Chris Fulbright. Good to see you, sir.
Good seeing you, my friend.
So, Chris, I was thinking when we launched this podcast, I really couldn't have imagined all the amazing stories and people that we would have met. And there's really been some fascinating ones, just hearing from, our local community and those abroad. But do you remember specifically earlier this year during the ACGME conference when we met today's guest? Remember how that came about?
Well, I remember the bundle of energy that walked up and the positive attitude and the huge smile. Was it when we were doing the short recordings?
Well, so it was. She came by our booth, and at first she was kind of quietly observing, and it seemed like she was trying to understand what we were doing, and then she leaves.
Right.
Then she comes back, and then she starts talking to us a little bit, and then she leaves. And then she returns again, and she decided, okay, she's going to record the short segments we were doing for the ACG montage show. And from there, we just really hit it off and completely enjoyed the conversations we'd had. And she just kept coming back. We loved it. And in fact, I think that you and Joe and I all agreed that was probably the highlight of ACGME for us.
Dr. Amy was definitely the highlight. Like it left me feeling that event that so many good things are coming down the pipeline. Absolutely.
Agreed. And so Dr. Amy Matecki is and was really one of the most enjoyable parts for me. It certainly was not the trip home. I don't know if we want to go down that. I think I still have PTSD from having to sleep overnight in the airport. So we'll just move on from
Let's just focus on her smile and bundle of energy. The trip home did shade the entire event, but sleeping with your teammates in a airport overnight is definitely something to keep in mind.
Not something I need to repeat
through Orlando. That's right.
So we are delighted once again to connect with our friend, Dr. Amy Matecki. Amy, welcome to our show.
Good morning, and thank you. As you two as a talk, just bring all the sweet memory back to me. And I remembered how I get caught by you guys at the signs. And I remember I was like, it's funny you did. I was very cautious, because I'm not the type just to go out, but your sign, your logo in the back, physician patients, was really caught my eye, which this is what I have been doing for the last 30 years, because with my own personal family history, and just really for someone believed what I believe as a physician-patient's partnership, it's really incredible. So when you guys talk, bring a lot sweet, happy memory back, and it was every word you said is so true. Thank you.
Well, it was a lot of fun. So Dr. Matecki has an impressive resume. So let me just quickly share the highlights and then we'll dig into today's chat. Dr. Amy Matecki completed Western Medical School in China in 1989 and was a practicing physician before deciding to move to California in 1994 to study and practice medicine in the U.S. Stateside, she completed her internal medicine residency as chief resident. She served as medical director of integrative medicine at Alta Bates Summit Medical Center since 2008. In 2009, Dr. Matecki received her degree in acupuncture and Chinese medicine from the Academy of Chinese Culture and Health Sciences. As chief of the integrated medicine department, Dr. Matecki and her colleagues from Western and Chinese medicine created hospital privilege policy for licensed acupuncturists in 2011, designing policies, procedures, and training methods for acupuncturists to join the medical staff to provide inpatient acupuncture services at the hospital for pain management, cancer treatment, side effects, and symptoms of opioid withdrawal. During that time, she helped co-found the nonprofit International Center for Integrative Medicine, where she helped create the first Chinese medicine residency in a U.S. academic public teaching hospital. Her work continues to bridge the benefits of Eastern and Western medicine. When asked before this show, Amy shared her goal is to partner with everyone who wants to change sick care to a wellness care model in the US and around the world. And with that very lofty vision in mind, my first question here is when you came sauntering by our booth, did you know that you had such a great story to tell?
Absolutely not. I was just like intrigued by your sign there as a physician patient. In a way, I would say, let's say it's this way, because I kept myself for a long time, feels like I'm a lone wolf. Although I do have a team of practitioner and a physician being supporting me for 20 years, but still I feel like it's a long ways from my goal. Even today, you were talk about that. Even I was fill the forms like what my goal is. I did had a bigger goal at 20 years ago when I started the training, almost half a century. When I realized I was in the public hospital doing my training, I thought of so many conditions, headache, nauseas, those are sometimes it's just so easy. I can, have a treatment within no time can make a patient better, but there's no place for me to expand that. So that was at the time I said, okay, when I finish training, I want to bring something to the US healthcare system. And also being an immigrant, right? So I want something be proud of it, what I can use my heritage, and also I can contribute, make this medicine, healthcare system be better. So I did have a very big goal, but 20 years later, if you ask me, there's a lot of hardship. I think today with you guys actually is like a booster. I did not expect it like this. I'm in a way.
We have that effect on people.
So that's where as you initially introduced, I went back a few times because it is interesting. I thought to myself, I was like, oh, so it's not only me thinking this way. We will dive into it. Why physician patients? Because that's a bigger part for my training, as a physician from China. So my training is as a physician, always thinking about it. You are a patient also. So whatever you gave it to the patients, the therapy, the treatment you offered for patients, would this pass your speedometer? This is going to be for you, for your family member. So that was one of the questions when I was in training in China. It's little bit different than here. I will tell you when I go through the internship here, that's the first thing they wanted me to separate. Don't think about this is a patient's care, and don't put you in the equation. You clouded your judgment, which I can see why is that too, because sometimes you are too much into that. You might be forgot the evidence-based side, right? You too much into the individual. So I can see the benefit for both of them, but how do I integrate it and really align, provide the best evidence-based care, but also don't forget, this could be your family member, this could be you. So that's where I'm still working on that because every day when patients are coming in, during the interview, the consultation, just putting me back into their shoes again. It's just like all the time I'm as a physician, I'm juggling with the healthcare system. We really have a great, great healthcare system. I cannot say enough how advanced we are. But then there's a side I always thinking how I can complement each other, make the system better.
Can you discuss the difference between studying Western medicine in China versus studying Western medicine in the United States? And did you notice glaring differences immediately?
So in the medical school in China, we have two systems. One is a Western medicine system, another one is a Chinese medicine schools or universities. At that time, this is a talk about over 30 years ago. If you apply for the Western medicine schools or you apply for Chinese medicine schools, A lot is purely on your interest. We have all those top, students, but they love the Chinese medicine aspect. So they went to Chinese medicine and vice versa, right? So when I applied for Western medicine, I was totally on the route. I want to be a surgeon. And I did a 6 months of surgery. So I give the credit for women surgeon in this country. Every time I look at the surgeon I work with for women physician, I absolutely salute to them. It's not easy to be a woman surgeon. So get back to you. So the training with the Western medicine, the different in China is also we added the Chinese medicine part. We have a section or a semester, we added the Chinese medicine as a part of the curriculum. And I remember at the Western medicine school how much we were mock, of a Chinese medicine doctor. They all kind of like antique. We were thinking that, in the Western medicine, now you bring this antique medicine in, right? But it was a nice part, it's like a little break for us. We go to their clinical shadow, and you can see the Chinese medicine doctor was really literally sitting there, talk to patients, right? And they talk about the food, talk about how they thinking. So we were there, observe, and then we were write the prescription, what they wanted, all the herb formula. So we were kind of like, that's how the way you do. The doctor say, I want this herb, so you copy it, and then the patients will take it, to fill it in the pharmacy. But at the time we watch it, we were kind of like, oh, it's interesting. They are really slow paced. They just yakking with the patients. But then as you go to the terms, right? So you start to see the return. The patient will tell you, I'm better, then you watch it. And then we go to the acupuncture clinic and we watch it. This is all in the hospital setting, right? And then you go there, patients goes in, pain, shoulder pain, and then they leave, they can move their arms, right? So you're like, okay, I guess it's okay. Because of the culture I grew up with, especially my parents, played a big influence on my medicine, how I practice. They always want to bridge the best of the East and the West. So that's where the differences, I believe in this country right now, certain universities started at it, like my residency training, over half a century ago almost, right? We invited the Chinese medicine doctors to give the interns lectures on Chinese medicine, acupuncture, qigong, tai chi, those kind of alignment of the medicine. So that's where I see the differences, but this is a very prevalent. I don't know the rest, but I noticed it. Some of the university of the medical system or schools started invite Chinese medicine doctors or practitioners, started give the students a talk. I started doing this. So that's with the Western medicine system, the differences. And then the training. The training, I must say, is like an eye-opening for me. The 3 years, training, internship. I did an internal medicine residency. The first 6 month internship is really struggling for me. Language is a bigger part of it, and culture. I was not the star intern. The first 6 months, I don't know the program was decided to keep me or not. So for anyone here, you have to be perfect. Don't. So that's how I learned is I will figure out a way not to quit. So I tell you how I didn't do well the first 6 months is this, because it's really like a culture. So for any foreign graduate, especially you have Chinese training background. So the big difference in internship in China, you cannot give a drugs or you cannot give a treatment without a report to your resident or attending. But here is very different. The internship, so the big learning for me is patients is yours. Give me your treatment plan. And then, discuss it. This is your patients. This is the plan you're going to provide for the patient. So what I did is I always ask the resident if this is okay. But apparently, sometimes they feels like I wasn't confident. Because in China, the training is you do not have your own idea. You have to ask us. to give you, at least that's the time, this is a way back 30 years ago, the training. Now I know it's different because many of us, US, we help to, to change the way how to think, practice. So you have a lot of independence. But that time, I didn't know that. The first 5 months, I was like always ask the resident. Each rotation is different, so I ask the resident, "This okay? This okay?" So finally, I get labeled as she doesn't have a confidence. I was already practiced physician in China, so that's another story. So that's a part of the me. But on the 6th month, what changed, I have a physician resident the third year, and he is American born Chinese, but immediately he realized, oh, it's not, it's the culture. So he recognized the culture differences. So he told me, he said, in the future, don't report to me everything. Just write down what you want to do. And so I started doing that. And I was like, oh, okay, you don't want me to report to you? He's like, no, I don't want to hear from you. It's like in the beginning, it's hurt, right? But he recognized that was the reason I get labeled as not confident, about the patient's care. So that's where I did. And at the end of that 28 days, I become the star intern because I bring all the patient's care. I have the little bit experience, right? So, and then I would just start to flourish and shining. But it was not easy because I feel like he's so rude. Yeah, that's all the culture part. I was like, typical Asian male. But anyway, so it just the part I look back, I was like, how blessed I am. All the way around, I have so many people carried me, supported me, even without I knowing how much they wanted me to succeed. And I know at the end of my internship, so from that month 6, I start like totally take the ownership. So if there's any part of it, and that's a fast forward 30 years later, I start to feel like the Chinese Americans, many of my peers didn't go through like what I go through is because they always confidence, like you in the beginning described, right? So that's my character all the way along. I came to your booth dabbling a little bit and then left. You can just see you guys actually encouraged me. I don't know how many times. Finally, you guys passed the mic to me and said, hey, say something, say something. And then later I heard you guys put all this together when, Joanna said it to me. I thought, oh, wasn't it too bad, huh?
No, it was great. And we could tell that you
fantastic.
wanted to say something.
Yeah.
Just didn't realize that it was such a great story. And I have to say, for the record, I have never heard anybody say that their doctors spent too much time yakking it up with them. I think, in fact, patients probably want more of that, more time. But you know what? I bet you 100% that doctors want more of that too, that they want to be able to spend more time with patients. So it was funny that you said that, but it's great to hear that. Do you see any of that changing where there's more time being spent?
Well, this is another part back to like here, practice for this many years in this country is we're the struggling part for primary care. Currently, the practice here, I'm grateful for the hospital allow me, to spend the time with the patients. I know many primary care physicians still struggling that. And the patients want to spend the time, but you are limited. So there's a physician burnout. I know the medical system continue make the change. I think compared to before, maybe there's a shift here because of the, like a physician wellness program, integrative medicine. 20 years ago, when I talk about the integrative medicine, everybody thought I was from Mars. And I was like, this is nothing different. We've been doing that in China for 50, 60 years. So I think currently the healthcare system is try to change the ways for better, but I don't know how successful it is, because still you are limited with the time, especially when patients bring the long list. And as a primary care doctor, we will say, okay, we will address 1 or 2, keep the rest of the 10 for the rest of the year, So So that's where you can hear there's a concierge medicine, there's a functional medicine, so there's a lot of specialty integrative medicines. Wow, for the specialty physician want to talk to patients or want to hear from patients, which is your sign there. Physician, patients, you can interpret it many ways. But at the time when I walk your booth, I think about myself as a patient. I was like, oh, wow, this is so cool. Somebody else thinking like me,
Dr. Amy, listen to your story again, first of all, we are so blessed that you did choose to come speak with us. I mean, you've been such a great joy for us. I think about if that other physician hadn't stepped forward and said, hey, Dr. Amy, we view that as a lack of confidence by you asking to work on the team and ask other people's opinions. That flexibility for you to be able to take that information in and then change, right? As you said, you became a star at that point. It reminds me of your story when you were telling us about you showed up and you had no patients and you walked into, like, patients, not time patients, but you had no one to help. And you walked in and said, hey, who needs a needle? Right? So this gap that you had, and you took from that again. This is one of the things we love about you, where you said, hey, I had to figure out a different way. Let me find out what the language is. Let me find out what I can help cure and then present that. Can you share that story with our listeners about how you then took that and helped to grow and ultimately help thousands of people? Do you mind sharing that?
Well, thank you so much for remembering that story. It's interesting how you bring the story back. So this is where fast forward after the training, and I was invited to join the oncology practice. And the director of the oncology at that time really don't know anything what I do. What he understand, because I was his resident and the team of the oncologist, because here is at Berkeley, right? And the patients are really into all the alternatives at that time, called alternatives, right? They always try to find another ways, to help themselves better. And it's really highly educated, all the patients. So I was invited, the oncologist said, I realize you have 2 degrees, and I think you can help my patients, their safety. We don't know what they are doing with the leaves, the tree barks, all the stuff. We don't know what it is. But we thought that maybe you can have those touch-feeling stuff, for my patients. That's exactly the word I was invited. Okay. I have no idea what it was. So I came in, thought, okay, I'm going to join this group. And also he said, you will like my patients. At the time, I said, let me see what it is like. I joined them not at the full time. The first, I was like just part time because it's harder for me to commit in the beginning, just like with your booth, right? So I was like, okay, let me see if it's a workout. That's fine. If it's not a workout, I still have something else. So I'm not just depend on this. The director said, no, you will be fine. You will like my patients, and you can totally develop a future for yourself. And also he said, if you cannot develop this practice in Berkeley, forget the rest of the country. So I didn't know that mean either. I was like, okay, great. I'm a physician with 2 medicine. I thought that this is going to be really desired by the public, by the patients, by everyone. So I wear the white coat, one pocket with a stethoscope, another pocket full of the needles. So I went to the cancer treatment room, right? And I walk around, ask who want needles. And after an hour, I get all like rejected. Nobody said anything. So I'm like, that's strange. So I spent another hour moving around. When you have nothing to do, and I keep asking everybody, there's like 20 beds, 20 rooms there. And some of the room have 2 chairs, have 2 patients. So it's like almost 30 patients there, and nobody wants you. It's not an easy feeling. So I went back after 2 hours. I was very disappointed. I was sitting in the director's office. I remember I crossed the table with him. I was like, why you invited me here? And he said, what happened? And we have a very short conversations. I said, nobody want me. He said, like, what did you tell them? I said, who want the needles? And he looked at me, he said, maybe you need to ask a different question. So I looked at him and he was busy doing his own stuff. And then I was like, okay, left. You don't bother them. So I left. I would remember I was in the hallway from his office, walked to the treatment room. After different question, what kind of question I should ask? But that's later on actually is a big lesson for me to learn. You need to know what the patients wanted. And also because I don't know any patients in the rooms, right? I have no relationship and I already get rejected after 2 hours. Nobody pay attention to me. So I started kind of like go to the nurse. That's where I would see the part of how I developed this successful practice. Nurse has become a big ally for me. So I kind of like find the nicer nurse. So I said, so why the patients are here? I know they get a chemo, but what else they are here? They're like, oh, for hydration. I said, hydration because, they can't eat, nausea, vomiting, all the stuff. Just that one sentence, like a light bulb went off on me. So I was like, okay, I'm going to ask this different question. I said, who has nausea, vomiting? Almost 30 patients there, half of them is like that. The rest of the day, I was just so busy, could not even get out of the treatment center. So I become the most wanted. So I feel pretty good,
Yeah.
So that was, thank you for remember that story, Chris.
Absolutely.
That was 20 years ago.
Yeah, but how interesting though. It's not the solution. It's the question that gets people to try the solution. Are we stepping over the solutions too many times? You brought something a second ago, and I know we have so many exciting things to talk to you about, but Paul and I have had the opportunity now to visit with many physicians and leaders in this community. And you brought up about the time that physicians are actually able to spend with their patients. That's kind of been a theme. You brought up physician wellness and the stress that comes along with it. I'm curious, that seems to be where physicians have come in and said, hey, we need to see 20, 30 plus patients a day. We need to be able to do this. We've got to be, the practice has to be profitable. That seems to be a gap right there. Can you share some more about your perspective of patient care and time with the patient, and with your experience, what that possibly could look like better, both for the physician and the patient?
Chris, this is really good you brought this up because, as a matter of fact, this year, I think the ACGME conference, gave me a lot of thought. Also, I see how they want to train the future physicians. And also, the clinical practice part, for us as a physicians. First is like, how did a physician get a burnout, right? And one part of it, if you see half of the patients, like 15 patients a day, or you see 30 patients a day, you definitely have a different attitude. And, the drainage, so there's many of the reasons why they have to do 30 patients instead of, 15 patients because of the payment scale, like reimbursement. I'm glad you brought this up. And also, for the private practice physicians, it's less and less. They become the dinosaurs because they cannot maintain that kind of the flexibility. The overhead continue rising. You can't maintain your staff, medical assistant, let alone hire a nurse. So the cost to maintain a practice continue rising, but the reimbursement for the physician continue cut, right? In a way, I know the Medicare try to shift. This is another part right now for me to see with the Medicare how we direct, the expenses. This is a part of the CMS. And every time I know with the California, a little bit of difference, we try to help the physicians. I believe there is a change or shift to try to get reimbursed a little bit better for the primary care. But in my own practice, I can tell you I'm working harder for the last 5 years from COVID, to currently. As a matter of fact, I even just look at my file of the tax, and it was shocking. My CPA actually say, "What happened? You didn't work." As a matter of fact, my patients' volume is going up, but so what happened? I work more days, more patients, so I don't really have much time to digest or to look into it. This is why a lot of primary care can't sustain, or private practice can't sustain. You're absolutely right. So that's where, for physicians, the only way they try to see more, because they try to maintain the flow to keep their cost, at least they pay their bills, right? Many of the physicians actually left the private practice, become the employee, what they said, because at the end of their private practice, they make sure their employee, their staff get paid. They are the last one get a paycheck home. I look at myself, right? So my cost of the living continue going up, but my paycheck started going down. So this is where I don't know what to do. The only way I think patients want see the doctors can control their practice, which is a private practice. I don't know outside of the country, but I think in the Bay Area, I know it. The private practice is started to dwindle down.
We're seeing that all over, and we talk to physicians all over the United States, and it's very typical to see that exact situation where it's harder and harder to maintain. I have a urologist that I was talking to not too long ago that was about to have to shutter his doors. Then he figured out how to file for the claims better, that he would appropriately be reimbursed, because that's, again, you're being trained to be a physician, not how to code. And so there was a gap there, and he was actually able to fix that. But for a decade, he wasn't able to figure that out. Nobody pointed that out. The other thing we're seeing is the concierge medicine starting to rise a little bit, where you only take on a certain number of people, and that, I think, answers the question, or rather solves the problem to a certain degree. But there's only going to be a handful of people that can really afford to pay an additional cost on top of that. But I think that solves more of the problem for the physician to be able to see less patients and still have an income that is deserved, and they can afford to have that ongoing increasing cost of living as well. So,
I'm glad you bring this coding part. I can tell you this, for me to learn the coding part, I'll give you the example, like for lab test, diagnostic, right? So you coding the ways. I'm still learning about this part because, I'm trying to look at, just, we want a Medicare, being the primary medicine, but you have to support the physicians. And also, what my personal experience, I don't know is appropriate, brought here, because I'm really in a level, I think, why physician burnout? We get trained to help patients, right? But recently there is a couple events, for me to think, you put a physician in the middle, get a blame on something we didn't do it right, but we've been penalized because of the system doesn't support. So two examples. One is the lab test, or the diagnostic test. When I order, like for example, like a bone density scan for women over 65, so you order that a bone density scan to screening for osteoporosis, right? Because for long-term, the fall, all the complications, so they try to make sure, you have the good bone density. But there is a ICD, however the way for Medicare patients, you have to use the way. I'm still learning that term, okay? Because of my staff tell me if I coding say osteoporosis screening, or patients already have a diagnosis with osteopenia, but if I say the diagnosis code, I'm order the bone density scan, I cannot say osteopenia. I cannot say for osteoporosis screening. I have to use the word is like decrease the bone strength. Some kind of the term I'm still learning. But if I code all the other terms, get it denied. So every time I order that test, you try to do it, try to save it, and then get it rejected. And then what happened is patients get rejected, and then they call the insurance. They said, your doctor ordered the wrong code. So even this year, I maybe use that ICD code, but next year the code is changed, they accept it. So this is where the part I'm get really, I don't know how the physician not a burnout. I think I'm a really very level-headed because I try to be zen or try to pray a lot. It just like drive me crazy. It's like then the patients called, you order the wrong code. So I get blamed, right? So that's one case with where I'm ordered something. The second right now with the pain medication, the opioid medication. Recently, I have a cancer patient needed the pain medication, right? And it's someone actually is interesting. She's not someone just like a normal patient doesn't speak up. She is like the CEO of one of the healthcare system. I'm not saying it's someone just special. It's like you don't think this patient is like have an issue with it, seeking for drugs or because I know her whole family, right? But anyway, she was like excruciating pain. As an integrative medicine doctor, I don't just do acupuncture. I prescribe pain medication. And she is one of my primary care patients. I take a look after 2 acupuncture treatment, get her a little bit. I said no. She has no sleep. She could not sleep, right? So I ordered the pain medication, which is I didn't even know, but they call like a cocktail pain medication, which is I ordered for 2 types of pain medication. One is a little bit longer acting, one is a short acting. And then I have the sleep medication. So 3 medication is all regulated, right? So I need to use my DEA certificate. So they call that as a cocktail medication. That's how the physician have to learn all those new terms, right? When I treat patients, I was just like, I need to control her pain. And I think I gave her the prescription in the afternoon. By 5 o'clock or some, I didn't realize they never refilled the prescription, the pharmacy. And the next day morning, 8 o'clock, I discovered that the patient did not get the pain medication. You can imagine, how what I thinking is. Patients are totally in pain and they cannot be controlled. So I called the pharmacist. I thought it was at the pharmacy. I said, why don't you fill my prescription? Because as a physician, I didn't realize what was the reason. I just feel like how pharmacies, not honor my prescription. Someone's already for a week could not sleep and in severe pain. 15 out of the 10. That's patients describe the level as a 15 out of 10. We only have a 10, right? 1 to 10. If someone come in and said, I have a 10 out of 10, so you know it. Someone said, I have a 12 out of 10, 15 out of 10. You can imagine the pain level is, all right? This is someone still going through the cancer treatment. So anyway, I said, I want someone in charge of that pharmacy. Why my patients didn't get the prescription? I think the head of the pharmacy knows, they can hear from my voice, right? She was very kind and nice, and as a pharmacist herself, she just basically said, Dr. Matecki, we want to give the patient's prescription, but it's not approved. And you will prescribe a cocktail formula here, need a special approval of the stuff. And so anyway, finally the patients got the prescription, but I have to go through some kind of a paper process. But the point I wondered, how many other physicians going through the same thing with me get this patient is totally understand because herself is in the healthcare, right? Not even a word call back, screaming at me, nothing like that. As a matter of fact, she said, don't worry, it's just 1 more day, it's no big deal. I am here broken my heart. Someone suffer pain like that, work, lead the healthcare system, and suffer like this. So that's where, I don't know how to change that. And I wondered how many other physicians suffered like me and how many patients suffered like this patient. So this is currently with the pain medication. I can see with the physician free of order pain medication because, and also you ordered, you're not honored with your order, right? So this is where the part I feel like I'm losing the battle here.
Well, I don't know that that's true. I think that you're just facing the same battle that a lot of people are, and it is hard to change that. But you are making a difference. I'll tell you, this went a completely different direction in terms of the information and conversation that we thought we'd have today, but still highly valuable to hear how you're so sensitive to the patient's needs and their pain and how that just resounds. It's no wonder why that just compounds and adds to burnout. I can't really change something, and my patient's in pain. So what's going on? What can I do? So that's also switch
Paul,
a little
why
bit.
Dr. Amy's going to be on our podcast multiple times.
That's right.
It's kind of like your bio when she sent it to you, and she's like, "You want me to put 40 plus years of experience into a paragraph?" And I think our listeners and ourselves are just understand Dr. Amy has such wisdom and experience. Rest assured, as we go through this, she'll be on again, and we'll continue to share her experiences.
So I want to switch direction really quick because in this situation, you were talking about something you felt like you couldn't really make a change. I want to talk about what you have been able to make a change in, and where you've been able to come in and make a difference in integrative medicine. And if you can, talk to us a little bit about how you have started to build that out and integrate acupuncture and really where that started. In fact, if you can, I'd love for you to share the story about you going through and introducing this and how your husband kept a specific description away from you to protect your ego.
Oh, you mean that?
You know what I'm talking about.
Yeah, the term, okay, that's very funny. In the cancer center, this is like 20 years ago. Once I started getting busy, more patients come to me because I find that what they wanted, with the nausea and everything. So I started getting more and more patients and the staff support. So really start become a very successful, and no one see this as coming. Patients is happy, and the doctor is happy, nurse is really happy, because they not get called every 5 minutes for nausea med, for stress, So I was really make a differences in the treatment room. So I feels like I was walking above the water, And until one day, one of the oncologists, he's really older, he retired. I have to give him the credit because at the time I didn't know, he's highly respected. He walk around, he's like, "What is this voodoo medicine is in this cancer center here?" and so I was like, "Voodoo medicine?" I said, "What is that?" So I didn't know, but just from the voice, I know probably not something good, right? And then I went home, I asked my husband, I said, "What is a voodoo medicine?" And he looked at me strange because he thinking, how do I know that kind of language, right? He said, "Where do you hear that?" I said, "Oh, today in the cancer center, Dr. So-and-so was said that in the middle of the room. But I just see there was a silence, but must be something is not good. But he's such a sweet oncologist, right?" He said, "Oh, never mind. So don't worry about it." So I have no idea. There was no Google that time. So I just forgot about that, So move forward, and 2006, a year later, one of the patients told me, said, "Oh, it's really interesting. This is like a voodoo medicine, I was like, "Oh, wait a minute. What do you talk about it?" The patient said, "You don't know?" I said, "No. I heard about that, a while ago, but what does that mean?" So the patients explained. I can tell you my rage. That was, so it's bringing my memory back, and I was quite upset at the moment, So I went home. I asked my husband. I said, "Do you know the word voodoo medicine?" He's like, "Yeah." I said, "Why don't you tell me that?" He's like, "You would quit." It's interesting as he know me, I would have quit if it's a year ago, right? But then now it's different because if I'm quit, what about my patients, right? So I cannot just walk away with something, just like you developed it, and because it is hurt my ego significantly. And it's to the point I was like, oh, wow, this is why in the beginning it was so hard. And also it gave me thankful to my patient and the staff who embraced me for the last 2 years, right? So as my ego dropped and in a way the quit ego dropped and another ego rising is like, hey, guess what? I made it this voodoo medicine prevailed here. That's actually is pretty good. So anyway, now I'm rising on that kind of ego actually doesn't bother me. So it's another driven, So I was like, okay, let's go find out who else have this kind of program. So that's where I started putting myself out there to see what other institution we have those integrative oncology conference, Society of Integrative Medicine. So there's many ways I started aligned with other physicians. So that's where, sometimes I still feel like I'm a lone wolf in the island, but you do as a physician, you have to go reach out, like what you said, the concierge medicine. I think physicians try to find a way we support each other, wellness. I think the hospital, the system try to do the best that they can to support the physician. But sometimes, because of the reimbursement, the healthcare, so everybody's struggling, so the big institution, the way from I see as a immigrants, I came from a socialist ways, how government, medicine, and I see this country, how there's similarity because we're in China now is really faster for the private practice, private hospitals. So in a different way, it's more capitalist. But here it's very interesting. It's kind of like we swapped, So here we were more from a bigger, it's like absorbed, the private practice. So, but the part, I know that is for patients, you still thinking the old style medicine, like you go to a doctor and then you're going to spend the time, but the new system doesn't support that. That's why we created the nonprofit International Center for Integrative Medicine, where the part we partner with everyone, which is patients, healthcare providers, and I've been thinking about it, you guys too, with the media, which is rarely we use this kind of the source because for physician, we don't really heavily promote ourselves. We think it's word by mouth, in a way. But if we really want to make a change for the healthcare system, I think we take all part of it. Thank you guys for you give the physician a platform, for us to share, the struggling, and also it's easy for me to talk after 20 years, sweat, tears, and you think about it from the voodoo medicine, now it's become actually it's a more desirable medicine. And I have so many insurance right now refer their patients to me. Very surprised, with our practice. And I ask the patients, how do you find me? Oh, my insurance, refer to you. So I think there is a shift in a way as insurance company want to keep their customers happy. They won't listen to a physicians, so I'm on the other end, right? I wish insurance will listen to me a little bit.
Well, and I think that's probably what kept you going a lot of times is not just your care, but that your patients had really become your biggest advocates and really helping push things along, being open to the treatment that you were willing to provide, and then helping you grow the awareness of your voodoo medicine. I'm sorry. It just sounds so funny because there's so much history to it. But also you had said really back before you even got started with it in 2003, you mentioned there was only one article that was out there that had any information about chronic pain management for patients. And since then, you've done massive amounts of research through patients and cases, opened up the nonprofit, and now you've got a conference going on, I think in a few days.
Yes.
But don't try to get tickets because it's sold out.
But it's really funny is, initially 4 months ago, we've been talking about I want to put a summit together, for years, right? But we just really don't have the ability, and it's like we didn't really think about it. It's just, to the point that there are so many people request, why don't you guys do something, put a conference? So 4 months ago, my team, the board member and executive director, finally we said, okay, let's do it. And they asked me, what's your goal? So you think about this is a 4 month ago, right? So I said, okay, let's just see if we can get 70 people in the dinner table. We can get 50 sign up for coming for the conference. I said, I'd be happy with that. Everybody thought, okay, that's doable, so, and I'm like, where am I going to get all those people, because, this is for a nonprofit, right? And it was funny. And same thing. So, the team and also with the media, we have someone will help live stream, right? And then they look at it, they said, they've been doing events for 30 years. They have never done an event started the planning 4 months ago, right? They were scratching their head. It's like, well, I guess 50 and 70 is doable, right? Funny, almost 3 weeks ago. So the team was a meeting and they were like, let's see where we are at, right? And it was like 100 sign up for the conference. At that time was like 150 sign up for the dinner to support it. And the one does have a live stream. He said, where did you guys get all those people? So anyway, so we have to go, okay, that's enough, let's close it. But then just as of this morning, you saw I was still on the phone, is 180 for the dinner. And they still have a lot of requests that want to come. And those are the people we were invited from the beginning, right? And now they all put on their calendar, they're going to come. And she was asking me, she said, Dr. So-and-so want to come, this one. And she like, would you going to open, a section, for that? So anyway, we will find out a way, but that's a good problem. But then they tell me the room maybe, a little bit getting smaller because we didn't thinking we're going to get that many people in the room. But yeah, now that we are happy, there's more people, I guess, want to hear from us, want to support us.
Voodoo medicine is very popular these days. I just have to look out there in the meeting. So you're breaking traditions, you're making waves, and it sounds like even the numbers are surprising you. So you started the show with saying that 20 years ago you'd had bigger expectations, you had loftier goals. So where to from here?
You guys get me all excited and thinking in a way. So that's where I say the team effort, right? Because sometimes I feel like I'm up against the battles, right? I made that two example. I was like, it's sometimes I feel like I can't do this alone, right? But then even this morning, talk to you guys and share all the stuff, you get me excited. So like, okay, if it's not me, and then who else, right? So the part I think getting me always thinking we have one of the president said, don't ask what, the country can do for you. So I was in my one of my talk, I put it there, don't ask what Chinese medicine can do for you. What you can do for the Chinese medicine. I think I was enough have a slide like that, and I also have the president candidate's picture there. So get it back to you is what can I do for this healthcare system? I still want to promote wellness care instead of a sick care, right? Because 20% of the patients at the end they are dying in the ICU, including my own family member, right? And I know why, but still sometimes it isn't necessary. But I have two members. One is in the ICU now, another one is hospice care at home, right? So it's like there's a lot we can see as a physician and also with the patient's public. So the healthcare system, the cost saving effect, right? So where we look at, how the system would support the cost effective. get it back to you, the physician. When we talk to the patients, and we not get paid in a way, so you paid a little bit, but you spend too much time. It's really is the number of the patients, you spend too much time talk, that's the amount you're going to get, so that's what I mean. You not get paid for talk. It's not like the lawyer. Am I see that correctly? Charge by minute. Sorry.
Well, I think a lot of times the biggest changes that are made are done without receiving compensation, at least in the paycheck. So, you made a statement, and I don't think it was exactly this, but if not you, then who is really the question. And a lot of times we're looking around like who's going to show up and make these changes that I hope will happen. And the answer is Dr. Amy Matecki.
Well, I need a team together because that's involved the insurance, commercial, and also the payment, right? And also, I think this maybe can solve some of the physician burnout, right? Because if you get compensated better, when you spend a little bit of time with the patients, and then patients will be happy, right? And they feel like they've been heard, right? So there's many ways, and also I do because if you guys are there, keep help a physician. You give a platform for physician to speak for the last 20 years. I know I'm getting invited, but on this level, and also I think you guys have a good logo, physician patients. So, I am a patient, and also I have family of patients, and I felt you guys gave me the platform. So, for me to see the possibilities, right? That's another part I feel like it encouraged, even from this morning talk to you guys. I feel like, okay, I guess if it's not me, who, right?
I think you're doing amazing things. I think we all believe the same. And I'm sure that the patients that you work with believe the same. They feel the same. And the last question I have is something you've really talked to throughout the show. The show is called The Patient Physician. And I would like for you to just close us out by telling us what that means to you.
So let's say this way, because I think for physicians, every patient walking in, we can relate to the story. When we hear their story, we just feel like, oh, could be, my family member. This could be me, right? And I think, this is actually in a way very aligned. I have a humanistic part. It's like we wanted the patients to be better. Another part, for patients, coming in, many of my patients actually is well educated. Even some of the patients maybe not, but they really want the physician to look at it from their eye, to see how to help them. How many patients came to me will say, I don't want a chemo, I don't want a radiation, I don't want all kind of stuff. And I look at it there, I can understand why, because of the minute and you sitting on that chemo chair, you think about the side effect, right? You think about a lot of the stuff. So that's where for the physician, sometimes we can see we are not a good patient either because we were knowing too much. We're like, oh, I don't think I want to do this, right? But, this is where the vice versa role, I think to me is really very meaningful. That's another part. Every time I go to ACGME, the sign, the tagline for them is practice meaningful medicine, and which is yours, patient, physician, patients is very meaningful. Is we can exchange that role. And the patients, for certain patients, they know their condition even better than me. They came in with a big, thick of the research paper. I have to learn from them. So it's very humbling as a physician. You learn from your patients. And also, I can be on that chair, be the patient's too.
Thank you for all you do. Thank you for the time that you spent with us today. And I will tell you, I'm looking forward to seeing you at the next ACGME conference. So I assume that you're going to sign up and be there. We're working on that as we speak before the show. So
before you close, I didn't say much about my integrative medicine team, which my Chinese medicine team. Do I still have a little bit of time for that?
Absolutely.
Yes, of course.
Okay.
Yeah, of course.
Well, I think you are right, because in the beginning I was going to promote my integrative medicine team, and then we get to talk about the pain medication, other stuff. So I want to see the past 20 years, especially the past 15 years, the International Center for Integrative Medicine, this nonprofit organization. We partnered, actually the co-founder is a patient of mine. And he shared his story. Actually, he's going to speak up in this conference. The healthcare team is a Western and a Chinese medicine team. So from the beginning, we created as a side by side, respected to each other's arena. This group, the board directors, very successful, never think about themselves, all 15 years, contributed, lead on the policy. And then also I have the team, the Chinese medicine doctor, acupuncturists, like as earlier you mentioned. So work with us together, we change and help the policy, how to bring the acupuncturists into the hospital as a middle level practitioner. We work with the medical staff in the public hospital. It is a groundbreaking. So we bring the acupuncturists in as a faculty to train them 5 years and get prepared, created services called inpatients acupuncture or Chinese medicine consult services. Really help the patients, help the nurse. That's where in this conference you can hear how we did that is we did research with the intensive care units patients. For those group, the patients can accept it to see the benefit from acupuncture. That's another ground broken, with the evidence-based support. We were just to see the feasibility study. We didn't even see the safety and efficacy actually showed how much helped the patients and also the nurses, so we get less stress every 10 minutes called by patients. Pain medication decrease, antilytic, Ativan use in the ICU is very common. So there is just a all around the benefit. We want more of those research in the future being coming forward. And as you mentioned, there was only one article, acupuncture for chronic pain, cancer pain, published in 2003 in Journal of Clinical Oncology. Now, 20 years later, there's so many articles published, not only acupuncture, yoga, physical therapy, so there's a many aspects, wellness care research is being done. And even, our team is joint nutrition, how you see the behavior, change, help, with the stress reduction. We also added the medical qigong, to the hospital program offer for cancer patients for free. So it's all around we develop a practice, but also how we train the future Chinese medicine doctor. And also we train the physician too, as how we can see aligned together to better prepare the future physicians know how to talk to patients. And also because they work together, observe, come to the training together, they see, okay, the acupuncturists is not all the weirdos, the voodoo medicine, right? So they get to see, even just a couple of days ago, I have the director from the residency program, and she stopped me in the hallway. She said, I cannot believe the acupuncture can do for my patients. The patients have the legs swelling. They've been giving the medication, diuresis, diuretic medicine, try to decrease the swellingness. But for days, it doesn't make a progress. And then they consult our integrative medicine acupuncture team. They said, can you do something with it? So our faculty said, bring the student, said, yeah, let's try. We know it's safe, So they did. The next day, the physician walked in the room, the patient's leg totally become normal. She said, I never see something like that. So that's actually get me excited. It's like, another research topic. But can you believe you use the medication and then you can adjunct with the acupuncture, right? There is like a no or acupressure, so minimal side effect. And you can make a result like that. And I guarantee you that patients will be discharged out of the hospital sooner. So all the way around, I see it's not me, it's my team. I have a wonderful board, directors really foster, support me. And also I have the Chinese medicine team, physician team. Many of the physicians actually volunteered here. Same thing with the Chinese medicine team. They come to the hospital. If they do this work in their own private practice, financially will be very beneficial, but they're willing to come out to teach, to train the future acupuncturists, which I get asked a lot. Who else should I see? Because we can only meet certain capacity and with other places. I'm a graduate, now as a lead in the other universities organization. It's very happy to see someone after 2 years of training and then they confident, they know how to communicate with other allied healthcare and how to work with other physicians and the healthcare system. It's really gratifying, communication, safety, and also standardized practice. And in the beginning, I told the Chinese medicine team, I said, if you guys want this program to successful, even with my faculty, I said, one, if there's any non-Chinese audience sitting here, you guys are forbidden to speak Chinese. I said, you must speak English because sometimes, many of the faculty is Chinese speaking. I said, if there's one audience in the room, because the teaching is very important, you want everybody, to be on the same. And actually, I had the penalty there. I have a jar there. I said, I want the students to have the jar there. I said, if your faculty speak Chinese or you watch your faculty speak Chinese, and there is a non-Chinese speaking person in the room, I said, you go ask for $1. And at the end of this term, I said, you guys use this money for party, for food, whatever you want to do. Worked really well. But,
you created a Chinese swear jar is what you did.
Very good. So, so in a way, is really, we did a lot of the stuff. Normally, we don't think about the culture part, right? But it's really work. And then also, I said the Chinese medicine with my student, I said, if you're going to tell whoever, physical therapy, I don't care anyone, you said, we use acupuncture or we use the Chinese medicine to treat the symptoms. I want you to have an article in hand. I don't care if it's in Chinese or in English. If in Chinese, you're going to translate. If in English, give that article to them. And I tell them there's two words you cannot use, is yin and yang. Because in the beginning, 20 years ago or 15 years ago, if you talk to the Western medicine about yin, channels, meridians, energy, they look at you just like this is exactly the voodoo medicine, right? So I did in the beginning, we did a lot like normally we would not do. I said, don't talk among yourself. Because yourself, you can talk yin and yang, but now communicate is with the Western medicine doctors who know nothing about your medicine. If you say this is a yin deficiency, yang deficiency, they have no clue. So I tell them you can use the tongue diagnosis. Look at your tongue. If your tongue, there's ways you can look, you can train the physician. If you look at your tongue, it's a puffy, have a teeth mark all around, you can say, yeah, this is a deficiency, this is a fatigue. Just teach them something, very simple. And then they will engage, and then they will look at their tongue themselves. They're like, oh, it's true. Some of the day they are so tired, they can see. So you use some kind of the objective way, to help the physician to understand your medicine with the faculty and with the students. So fast forward, this program really prevailed, and that's where when we started doing this event, many supporters come from all over the place and they just say, we want to support you.
All that is amazing. And I know you're out in the Bay, but it does sound like the tugboat is there to pick you up.
Okay, thank you. Thank you.
Thank you again for your time. It's so great to visit with you and hear your stories. And I look forward to hearing many more.
Thank you for giving me this opportunity, and thank you for doing this amazing work. I really thinking maybe you guys can help decrease the physician burnout and bring more physicians come to your program to talk about their struggling with the pain medication and also the private practice. How could the system help them decrease the patient's flow? I just look at myself. I see double the number. I get paid less, compensated less. I need more support on that. Hope you guys will save more physicians.
We appreciate it, Dr. Amy. Thank you so much for your time.
Thank you.
This conversation was brought to you by Physicians Resource Services, a firm supporting medical professionals to improve their financial situation and pursue their personal and professional goals. The Patient Physician is produced in Austin, Texas. Editing and sound design are in the hands of the PodConnects Podcast Network. Please email questions or show ideas to info@physiciansrs.com.